Welcome to the University of California, San Francisco Sports Medicine Podcast, featuring Dr. Nirav Pandya, Dr. Brian Feely, and Dr. Drew Lansdowne, discussing hot topics in sports medicine and society. We hope you enjoy our podcast and look forward to hearing from you. Welcome to the UCSF Sports Medicine Podcast, 6 to 8 weeks with myself, Dr. Nirav Pandya, Dr. Brian Feely, and Dr. Drew Lansdowne. Today, we're going to have a special Sports Medicine Fellowship podcast. As many of you may or may not know, we have an excellent Sports Medicine Fellowship here at UCSF, and we're proud to have Dr. Alan Zhang, who is our Fellowship Director on the podcast, and Ajay Padaki, who is one of our current fellows during our fellowship this year. So maybe first off, we'll start with Ajay. Tell us a little bit just about your background and what did you think was the most important thing going into fellowship and what brought you to UCSF?
Sure. So thanks for the introduction. I grew up in Philadelphia, essentially, and went to college at Penn State. I studied chemical engineering there, and I also played squash there, which is why I was able to dominate Dr. Feely in our competition. I then went to Columbia for med school and stayed there for residency before coming over here. So I guess the first part of that question of choosing sports medicine, I think the combination of arthroscopic surgery and open surgery are really what drew me in. The ability to do open surgery, I think, is throughout orthopedics, but then developing arthroscopic mastery is something that I was really attracted to throughout my training. And I think that mix, along with the amazing outcomes, are how I got to sports. And then for moving towards come to UCSF, when I was applying a few years ago, I think the first thing that really drew me here was the actual case volume of seeing fellows doing close to 600 cases a year, in addition to the amazing location of living in San Francisco and the prestige of remaining at top 10 hospital system. So I think the combination of those attributes really drew me here.
Okay, that sounds tremendously self-serving, but I would agree that we have a good fellowship. So when you were looking through, you were, for people who don't know, who are listening, you were about 60%, 70% through your residency. What was the number one thing that you were looking at that you felt was important when you were making your rank list?
I think the ability of the fellowship to place you in the type of job you want to go to was something that really resounded with me. When I was on the interview trail, when fellows weren't really clear about where they're looking or how far they were in the job application process, that was something that felt like a red flag to me.
And then, so Ajay, at this point in your fellowship, do you think that's still the most important thing?
I think that you can probably leverage some of your influence from residency as well. So I wouldn't say that that's as important. I think more so the complexity and autonomy of your cases, along with your relationships with your attendings, are what I would think to be the most important.
All right. So for people who don't know, Dr. Zhang, Alan is our fellowship director. He was also one of our former fellows. So this time, many years ago, Alan was in the depths of despair of his final year of training. I think he came to me with tears in his eyes, wondering if the year would actually finish. So Alan, as fellowship director, what do you think makes the I feel like you were on a delay with laughing at that one. What do you think makes a successful fellow? And when you're looking at applications, what really stands out to you?
Okay, yeah, so just in case any potential fellows are listening to this, please edit that out about me being in despair from Dr. Feely, because it was definitely all fun and games during my fellowship here. But yes, as a former fellow and now the fellowship director, I do have some viewpoints from both sides of the table, so to speak. And I think I can speak more about this later on, but I look for some of the same qualities that Ajay looked for when I was picking up fellowship. And now that I'm sitting on the other side of the table as a director, I've really seen some fellows, the fellows that really make the most out of their fellowships are ones that go through it enthusiastically. So I pretty much kind of picture how I was as a fellow, and I try to apply that scenario to every one of our fellows, because I want them all to emulate I was. And essentially what I did was I worked hard from beginning to end a fellowship. And it's very easy to just operate, and especially at a program like ours where there's a very high volume, you get great surgical training. And if that's all you want to do during fellowship, I think that that you can do that very easily, but you also want to take advantage of your resources. So what I meant by working hard is I also did a lot of team coverage when I could, in terms of various like marathons and football, basketball, different sports, just so I could see some of the other experiences, and then also the research opportunities. I think as an applicant, as a fellow in sports medicine, that's really when you can do some very meaningful research in your field, because if you're not going into academics after you graduate fellowship, you might not be doing much more research. And for being a sports medicine fellow, you can really do some very appropriate research on the topics that you're going to be practicing. And nowadays, a lot of patients are coming to the office. Well, I've got an ACL tear. Why should you do my surgery? Oh, actually, I saw that you published a paper on ACL tears, and I can see that you're an expert on this. Even if that was during your fellowship, just having those type of publications and research in your background really helps you as a practicing surgeon. So I think a great fellow, sorry to be long-winded, is someone that just really takes advantage of all of the opportunities during their last year of fellowship, because a lot of people are eager to get done and start practicing, but you really have a lot of resources if you go to good fellowship, and if you make the most of it, it'll help carry the way for the rest of your practice.
Ajay, question for you. Obviously, a lot of fellowships, as you're going through the process, will talk about, oh, we have tons of cases, or some places say we have the most complex cases. What do you think is the important balance for you there? Is it volume? Is it complexity? Is it kind of a combination of both?
I think it has to be a combination of both. Training in New York during the peak of the pandemic, things like even basic ACLs were tough to come by. So when I was formulating my rank list, I was disproportionately emphasizing case volume, I think. But now, having done close to 300 cases already in the first 5 months, I don't feel like that can be the only characteristic that you're factoring in. So being able to do trap transfers, revision total shoulders, those are the cases that kind of have the most value at this point. So I think that you have to balance both of them.
And so, Ajay, I think when I was looking at fellowship programs, one of the things that I thought in sports medicine was there's so much variability. Like some places do shoulder replacements, some don't, some do hip surgery, others don't, and like team coverage, research. Can you like walk through some of the other like main differentiators between programs and what you were looking at a couple of years ago when you were applying?
I think I can take that both from what I was looking at then and how the job market has felt in interviews, and that having that total shoulder arthroplasty experience has been huge. That was something that I loved training at Columbia, and I wanted to continue doing in fellowship. And that's something that's a huge part of this program. Also, being able to do hip arthroscopy is very important right now in the current job climate for new sports physicians. So those were both big things. And I think that at least some exposure to coverage is important in addition to being able to do research. So there are a lot of programs that have different aspects of those, but I think there's only a few that really have the total package.
So Alan, I have a question about big versus small programs, because way back when there was the differentiating factor, which was the small programs were really mentorship level programs where you got that one-on-one mentorship and you really felt like you were joining basically almost like your own small practice for a year, versus some of the programs like Rush and HSS, and even to a similar extent us at this point, where you have the larger faculty numbers. Do you think that makes a difference in terms of training, and how would you advise trainees in terms of what's best for them?
Yeah, I think an important point about the size of the program is whether it allows you to get adequate mentorship. So a lot of programs, a lot of fellowships here nowadays are really focusing on providing mentorship for the fellows, because even after they graduate from the fellowship, fellows when they're practicing would like to have kind of like an alumni network, a family, so to speak, to call if they have questions, to text about tough cases, just someone that they can continue on that relationship even after they graduate. So being a good mentor is not just fostering their education during your fellowship, but their afterwards too, after they graduate. So if you're in a program that's too big, where there's too many fellows, too many attendings, the potential disadvantage would be that you don't really get to know anyone attending very well. So then it's hard to have that relationship and that mentorship in the future. The contrast to that is if you're in a program that's too small. When I was a UCSF fellow back in 2013, it was a one fellow program, and I didn't have any other fellow to kind of help me with like any administrative task if there was something, and it just felt like all the attendings wanted me to help them because I was such a good fellow, but there wasn't enough of me to go around and share. So having 2 or 3 good fellows on your team would be really, I think, advantageous, because you also have a really good bond with your co-fellows. So our program, soon after I graduated, we went to 2 fellows. Dr. Feely was the fellowship director back then, and he expanded it. And then this past year is our first year with 3 fellows, with Ajay and then his 2 co-fellows, Rami and Abi. And I feel like the one thing I've seen when you have a good a nucleus of co-fellows is that they become really, really good friends through this experience, both during fellowship and definitely afterwards. So when you have a program that's not too big but not too small, you have that right mix where you can really get to know both the attendings as well as the fellows. And we have 11 attendings on our sports faculty now with 3 fellows. So there's plenty of cases, plenty of diversity, but still it's small enough to where you get to know everybody very, very well.
Ajay, how important was mentorship for you, particularly going through this process? I mean, some programs have 20 attendings, some have a couple. Where was mentorship in kind of the criteria for you when you were choosing a place to go?
I think coming out of Columbia, that mentorship was very important to me. Having both Dr. Levine and Dr. Ahmad there, I knew that I wanted to go somewhere where I felt safe with the attendings, that they actually cared about my personal training and career. And those were things that I was really looking forward to try and ascertain what the relationship truly was between the fellows and the attendings. Like, that's probably going to be a little bit more difficult on Zoom, but I think that it's something that I was really trying to analyze on the interview trail itself.
All right, Ajay, 2-part question. What was the best question you got during interviews? And what was the most awkward question? Now, I'm sure it didn't come from anybody on this panel.
I think the best question I got was from your alma mater at Rush, of having to identify Dr. Ahmad's leg from a picture from the top down of 5 different people's legs. So that one's one that comes to mind there. And I guess the most awkward question would probably be just people fishing for embarrassing stories about my mentors that probably is not appropriate to share in a public podcast setting.
Yeah, we're all a little bit afraid of Dr. Levine, so don't share them. I'm tempted to ask Ajay another question about squash, but seeing as how I was coming off a 22-month hiatus and still beat you, I'm not sure it's fair at this point. So, Alan, when you're reading these applications and you're preparing to look through these, what do you think really stands out? Do you look for research? Do you look at who writes the letters, what the letters say? What really grabs your attention?
Yeah, so I think different programs will look for different things in the applications. For our program, which is an academic program at a large medical center, we do definitely want to make sure that our fellows have experience doing research. The minimum requirement for an ACGME fellowship is 1 publishable project / manuscript during fellowship, and all of our fellows do that, plus and then some. So it averages anywhere between 2 and 5 projects / publications per fellow. It's not so onerous where you're trying to write a paper every other week, but we do have really good opportunities for research, and a lot of fellows will lead high quality investigations themselves. So part of the things that we look for in our applications includes their research background, just making sure that they've done hypothesis-driven research and that they're able to lead a study. You don't have to have 100 publications coming in, but I think one thing we do look at some is research, and then also definitely the letters. Within the letters, you can definitely see a lot about each of the applicants. There's some mentors or faculty that'll write very, very long and elaborate letters, which are very detail oriented, and we can really glean a lot from the applicants through that. So the letters do make a big difference, and also just knowing the programs, knowing who their letter writers are, tells us a lot about what type of applicant we're getting. So I think all of the above are important factors for us.
Alan, what do you think makes a good fellow in your eyes? With all the fellows that have kind of come through the program over the years, what characteristics do you look for?
Yeah, I think the most important one is a fellow who's enthusiastic and interested in being there. So I think as Ajay was talking about, there's different things you want to look for in a fellowship. And I think in my point of view, there's 4 main areas of training that a fellowship will offer you. And of course, surgical skills, which is important. And then clinical skills, how to talk to patients, how to counsel patients, diagnose, as well as walk them through the recovery. And then there's the sports coverage, team coverage part, and then the research part. So for us, the fellows that have done a really good job are ones that take advantage of all 4 categories that we offer in terms of our training, where they've really been able to do all kinds of different surgeries, very complex cases, really learn a lot in terms of their surgical skills, but also taking advantage of the team coverage experience. Currently, our fellows will take care of the San Francisco Giants, which is Major League Baseball for people that don't know. And then also NCAA, Cal Berkeley, also University of San Francisco is also NCAA. And then we also take care of high school football and some local like races and marathons. So there's a whole lot of different team coverages that we offer. And of course, the research experience, which I've already talked enough about as well.
Yeah, I think, when I remember when I was looking, I was really fixated on case number. And in hindsight, I think the most important thing for me, looking back in my first few years in practice, was understanding how to talk to patients. And I thought my mentors at HSS, who were really good at discussing not only post-operatively, but how the patients were doing, discussing when things weren't going perfectly, coaching patients through, explaining things well, and being really kind of slow to recommend surgery. And I think it's often lost in the desire to do a lot of cases or the complexity of cases, but really builds your practice early on is being able to communicate with patients. And I learned a lot, especially from how well Dr. Warren would talk to agents and professional players versus how Dr. Rodeo would talk to basically anybody as the exact same person, and had even complex problems would be explained extremely well. And I think I gleaned almost as much from that as I did from the technical things that you learn.
And so, Alan, this will be our 2nd year of Zoom interviews for fellowship. What do you think? Because I always feel like the people interviewing may miss out a bit on personalities, what it's really like to be here, things like that. Like, what do you feel is missing? And then how do you think like our applicants can remedy that and make sure they get a good feel for exactly what we are?
Yeah, I think that's a great question. I mean, definitely at this point, year 2 over almost 2 years going in with COVID, everyone is very, very tired of the Zoom meetings. But for everyone's safety, we definitely agree with not having in-person interviews. So we're doing Zoom interviews, and I think you do lose some things with that. For one, being in a great location like ours, San Francisco, usually in January and February, our interview days are still sunny, and we can usually send our applicants out on a tour of San Francisco as part of the interview day, and really let them enjoy the weather and the surroundings. So we lose out on that aspect for some applicants that haven't been in San Francisco too much, who won't know the lay of the land. I think it really helps attract some of them into the potential advantages of the West Coast California lifestyle, which Ajay has already adapted to very, very seamlessly. So we lose that. But then with the Zoom, we also don't really get to, you guys don't get to talk to us as much because you're in kind of a formal breakout room session for 15 minutes and rotating. There's only so much you can really get from your personalities or our personalities from that. So I think it is a challenge, but we will try to definitely make our introduction faculty presentation memorable for you guys. I'm working hard on that, and all the other faculty are very nervous about what I'm going to say about them. But we want to definitely try to show you guys some things about our personality and what it's like to work with us. But definitely, it's challenging for Zoom. But we're all in the same boat, so we just want to make the most out of it. Yeah.
All right, Ajay, what's been your favorite case that you've been a part of so far this year?
I don't think there's been a case with all 4 of you guys in it, so I'll have to decide this very carefully. But I think
there is a right answer.
Yeah, I think the second trap transfer that I did with Dr. Feely probably sticks out as just a very high complexity case that I think, having seen one that the week before, really prepared me to rehearse that going into it, to execute it as efficiently as possible. So I feel like it was a complex case that went very smoothly, that definitely built some confidence in my surgical ability.
All right, I'm going to go around the table since we've all done sports. If you had one piece of advice in 1 or 2 sentences, Nirav, what advice would you give people when choosing how to put their rank list together for any ortho or just any fellowship?
I would say probably number 1 would be, look for the people and the mentorship aspect of things. These are going to be people you're going to be spending the rest of your career talking with and interacting with. So I think really look at the people, and these are people that you fit with your personality and ones that you want to be able to, call at 8, 9 o'clock at night before you do a case and ask for their advice. So I think the people are number 1 for me.
Drew?
I would agree with that as number 1. And then, so I'll add one more, and I would just be very honest about what you want to get out of the fellowship year, and make sure that the program offers what you're looking for from both the clinical, research, and coverage standpoint.
Alan?
Yeah, very easy. UCSF Sports Medicine and Shoulder Surgery Fellowship, number 1 on your list. If we're interviewing you, it should be number 1 on your list.
All right, Ajay, halfway through, what do you think?
I think choosing somewhere where you will thrive is really important, rather than chasing a name, which is something that I think you probably did a lot of in college, med school, residency. Picking somewhere where you really are going to flourish in your surgical ability and your life is something that I think should be the primary focus.
Okay, so my last question before we wrap up, Ajay, did you really play squash in college? Is that as good as it gets? Am I like close to being nationally ranked?
So when you ask whether I was a good fellow or not, I'm so committed. I will let the chief of the department beat me in one of our 3 games for the morale out there.
Yeah, keep in mind your co-fellow called out due to a toe blister that you have to sit down for. So yeah. But it's been a pleasure having you and your colleagues. And obviously, we wouldn't have you on if you weren't doing a great job.
Thank you.
Well, thanks, everyone. We could have a 6-part podcast about our sports medicine fellowship, various seasons. But once again, thank you, everyone, for joining our podcast, Dr. Zhang, Dr. Padaki, Drew, and Brian. And we look forward to having you listen to our next episode. Thank you.